Hi, Dr. Windisch again from Sparks Pediatric and Adolescent Medicine. Welcome to our educational series for both students and parents. Please remember that these discussions are not intended to replace visits with your physician. If you have concerns about your child's health, please make an appointment to be seen. We'll be happy to see you here in our office at area code 775-359-7111. Again, if you have concerns that this may apply to your child, we can't diagnose them over the phone, please make an appointment. We'll be happy to see you. Today, we're going to talk about something called Osgood-Schlater's disease. Osgood-Schlater's disease, or Osgood-Schlater syndrome, is a very common problem for a lot of early teenagers. Happens a little bit younger to girls than boys, right at the time of maximum growth, so at the time of their growth spurt. About 11 to 12 for girls, starting about 14 to 15 for boys, and lasting for roughly 2 to 3 years. It's a knee pain in the front of the knee, but it's not at the kneecap itself. It's just below the kneecap at the big bump on the knee. Can you see my knee?
Yes.
Or do I need to, you want to zoom in on my knee?
I can see.
You can see it?
Yeah.
Okay, so right here, as opposed to up at the kneecap itself. This is known as the tibial tubercle. There's a big growth plate that sits there, and that growth plate is where all of the tendons of the quadriceps attach. So they come across, they form a common quadriceps tendon, they wrap across the knee, and then they attach to that point. If your child plays a lot of sports that involve running, jumping, kicking, then they can inflame that spot right there, and that creates a lot of discomfort for them. It's usually pretty easy to diagnose on physical exam. Once in a while we need x-rays as well. There are similar processes that occur in two other places in the body, one at the heel and one on the hip. The one on the heel has its own name called Seaver's disease, and the one on the hip doesn't really have a real good name. It's called iliac apophysitis. But the process is the same, and it's where giant muscles attach to a small point at a growth plate. The good news is once the growth plate fuses, roughly 17 to 18 years old for boys and roughly 15, 16 years old for girls, the problem is typically gone, and it is very rare that this becomes so severe that it needs surgery. However, the pain can be rather exquisite in the meantime. So what can you do about it if your child has Osgood-Schlater's disease, or calcaneal apophysitis, also known as Seaver's disease? First thing is Motrin. Depending on the weight of the child is how much Motrin you want, roughly 10 milligrams per kilogram per dose. 3 doses a day taken with food. If your child is an adult weight, that's roughly 600 milligrams a day. But you need to talk to your doctor to make sure you're dosing that appropriately so we don't give your child an ulcer. Ice, 15 minutes 4 times a day, especially after workouts. And then avoid trauma to those bony prominences. So if your child has to do kneeling like in karate or in church, get some knee pads. Make sure you're not kneeling on hardwood floors or on tile, because that's going to irritate those bony prominences and just make the problem worse. What sports do we see it in the most? Soccer, running, bicycling. Those tend to be the bigger ones, but you can see it in any of a number of other sports as well. It's very frustrating. It does not get better right away. It takes several years, but it almost always does get better by itself, so be patient. Not everything gets better in 3 days. I hope this helps you to better understand a very common medical illness that's very frustrating for a lot of people. Again, if we can be of assistance here in my office, give us a call at 775-359-7111. We'll see you next time.